Good afternoon. My name is John Oudick, and I want to talk about ventilation within the spectrum of preventive activities to prevent COVID infection. Now let's talk about heat stress and wearing masks. The surgical masks, the blue ones, do not impose a significant physiological demand, and most workers who are in a reasonable state of health should be able to wear them without any severe physical problems. However, all the lab tests that they did were done for 2 to 3 hours or 4 hours in a lab, and yet people are wearing them 12 to 16 hours on extended shifts. So this really hasn't been fully tested. Obviously, there may be workers who have health conditions that do not allow them to wear a mask, and such persons should be under medical care for their condition and need to check with their doctor. In this climate where masks are mandatory, you might want to get a note if you're in that condition. Some workers have psychological barriers. I know of one worker that I tried to do a hearing test and couldn't sit in a hearing booth with the door closed. And he also couldn't wear a respirator. So again, you probably need a doctor's note, but there are psychological reasons why some people can't wear masks. Another aspect is heat stress. When you're wearing one of these masks, you have to treat it as an extra layer of skin. In heat stress, the thing that we're worried about is allowing as much as possible sweat to evaporate to cool off the person. And if you interfere with that sweat evaporation, then you're increasing the heat stress load on the body. Now, the portion of the face as a portion of the total body is a small percentage. And so covering the face is not a big burden when it comes to that. However, when you look at the temperature and the relative humidity inside the mask, which is usually over 30 degrees Celsius and a relative humidity of over 90%, it will make the face feel very uncomfortable. And certain areas of the body are much more sensitive to thermal comfort than others. For instance, the legs are not very sensitive, but the face is extremely sensitive. So even while we can't necessarily measure the difference in the core temperature of a person wearing a mask, the discomfort will be significant and needs to be taken into account. Finally, if you're using an N95 respirator, there's a CSA standard which states you need a respiratory protection program, which includes evaluations for screening people if they have medical conditions on an if needed basis. But it also looks after maintenance and training and notifications.